as health specialists say, with Christmas just days away, we still need to be concerned about rising cases of COVID, flu, and RSV. Tonight, WREG's Alex Coleman looks into the different ways you can try to keep your family healthy.
'Tis the holiday season for gatherings with family and friends, and with that also comes respiratory virus season, like flu, COVID-19, and RSV. For travelers like Kim Hilliard, their safety and the health of others is top of mind.
Well, if you haven't gotten vaccinated, then you need to wear a mask because it is, it's still rampant and you don't want to catch it.
Health specialists say we still need to be aware about respiratory viruses. Dr. Sandra Arnold is Division Chief of Pediatric Infectious Diseases at Le Bonheur Children's Hospital in Memphis.
But as RSV is going down, flu is going up. And we're seeing lots of flu, and flu makes you miserable. There's also COVID out there. They're the new variant of concern.
It's why it's not too late to get a flu or COVID-19 shot before the holidays.
But we also know, especially for higher risk people, people with underlying lung disease, older people, that the flu can make them really, really sick. They can end up in the hospital, and the flu shot will prevent that. The COVID vaccine, I think, is still important to get that booster.
An RSV shot is also recommended for older adults and pregnant women.
There is an RSV shot available for pregnant women, mostly so that they can pass antibodies to their babies and protect their babies.
Another way to prevent illness is to improve air ventilation indoors. Try opening doors and windows when it's possible. When not at home, wearing masks can help prevent sickness. And if you are sick,
I think that people just need to be aware when they gather. If they are symptomatic, if they're sick, they really should try to stay home. But even people who aren't particularly sick can still spread viruses, so just be aware.
Staying aware to keep you healthy during the holidays. Alex Coleman, WREG TV, News Channel 3.